One of my favorite things about being a dad is answering my kids' questions. I just love their curiosity, even the really tough questions, like where do babies come from? Actually, I left that one to Mrs. Healthcare Hacker. Well, today I'm going to answer you, our members' questions around the last couple of videos that we did on ways that you can save money on prescription drugs. Hi, my name is John. I'm your healthcare hacker and a dad of 3. Typically, I could answer all their questions, but today I'm going to try to answer your questions around prescription drugs. Before we get started, please take a minute and follow us on your favorite social media channel. That way you can stay up to date with our latest healthcare hacks and ways to navigate what is a very complex U.S. healthcare system. Our first question comes from Kimberly from Pensacola, Florida. Kimberly asks, I watch your videos, but my drugs are still really expensive. Are there other ways to save on them that you didn't mention in your previous videos? Kimberly, there is one major way that I can think of, and that's with pill splitting. And it only can be used in a certain circumstance and with certain medications. Specifically, you have to have a tablet. You'd use a pill splitter in that you have your doctor prescribe you twice the dosage. For example, if you're taking 10 milligrams of a tablet, the doctor would prescribe you 20. Now the price doesn't double. It goes up by considerably less. And then you can use a pill splitter to cut that pill in half. And instead of taking one pill a day, basically you're taking half a pill a day. This could stretch your dollar out farther and potentially put more money into your pocket at the end of the month. Our second question comes from Jorge from Houston, Texas. Jorge asks, what if I just can't afford my medication? Well, Jorge, the best thing you could do in that case is do a little research on your manufacturer's website, specifically if it's a brand name drug. In that case, a lot of times manufacturers will offer patient assistance or financial assistance programs which will significantly reduce or make the cost of your drug zero. Oftentimes these are based on your income. So you'll have to provide proof of income, either taxes from last year, W-2 statement, or sometimes pay stubs. It depends on the manufacturer. But if you fill out these and apply for these, oftentimes you can get your drugs for free or incredibly cheaply. Before you say, John, I probably make too much money, I'll never get financial assistance. It really depends. Especially if you're an older adult with Medicare, a lot of times the bar is pretty high as far as income goes before a financial assistance program won't be covered or won't be part of your reducing the cost of your drugs. So, even if you make over $100,000, I'd still look. Potentially, you might be able to get that drug incredibly cheap or free. It just really depends on your age, the drug you're taking, the manufacturer, etc. So it's worth the time to just investigate because you might be able to get your drug for nothing. Our last question this week comes from Tim from Forest Lake, Minnesota. Tim asks, my employer recently switched insurance companies this year, and my pharmacy that I've been going to for years is no longer a network. What can I do? Well, Tim, you really only have 2 options. Option number 1 is find a pharmacy that's in network or move to mail order to fill your prescription. It makes no financial sense to go out of network for prescription drugs. Oftentimes, and in most cases, they won't be covered at all. So you'll be paying fully out of pocket and they won't go to your deductible or out of pocket max. So I definitely would not go out of network for prescription drugs. The second option is you can stay at your current pharmacy and use like a cash-based discount program like GoodRx, InsourceRx, or Single Care. Now, that would only be advisable if you're not going to hit your deductible this year. Then it's probably about the same cost. You might even be able to get a little bit cheaper. However, if you're going to hit your deductible or you're a relatively high utilizer of medical expense, not just prescription drugs, then you probably want to consider switching to the new pharmacy that's in network. That's probably your best option and probably the cheapest for you long term. I want to thank everybody for all the questions. Great questions this month. If you have any questions about this topic or any other, please leave them in the comments below and we'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.